Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about lichen planus. And before I get into it, the first thing I want to make very clear is this is not any type of medical advice. If you have any questions about your health, make sure you go see your doctor, your healthcare provider. Go get the help that you need. It's super important. And this is definitely not any type of religious information. You know that. I mean, you've heard me say that on all the episodes, but it's true. This is not any type of religious advice. So if you have any questions about your religion, make sure you go ask your religious leader and see what they have to say. But I'll tell you, most religious leaders are not healthcare providers. So if you have any questions about your health, go see a healthcare provider and don't talk to your religious leader about your personal health, because they may not be able to help you. Anyways, those are my 2 cents. So today we are going to talk about lichen planus. So I'll be honest, I never heard about these things. I don't know. Maybe I think I lived in a bubble. I don't know where I went to residency. I mean, my residency was fantastic, really. But in OBGYN, honestly, we focus so much on reproductive issues. We focus so much on pregnancy, infertility. I mean, everything really is surrounded. I mean, I guess it's called obstetrics, right? So it's really focused on pregnancy and all the trimesters and all of this stuff that I feel like some of the gynecology part of it kind of gets missed. And I'm sure I had lectures on, lichen sclerosis, lichen planus and stuff like that, but I don't remember them. And so when I have patients that come in with these things, right? Like, unless you're thinking about it, it doesn't occur to you that what it is. So I'll tell you, I had this patient. Okay, so before I get into the topic of lichen planus, I want to tell you about this patient scenario that I had. So I had this woman. She is, in her late 30s. She's 38 years old, and she's never been pregnant. And she has been going for prior to her coming to see me, she was being treated for infertility. She went to an infertility doc, and she had been going for infertility treatments, I would say, for about 3 years. And unfortunately for her, it didn't take, the embryos didn't take, and she's been kind of struggling with her infertility. So she doesn't have any children just yet. But after all of these infertility treatments, she wanted to give herself a break, right? She'd been going through it for like about 3 years and she just wanted to take a break. But after those 3 years, she noted something different that was happening with her vulva and she wasn't really sure what it was. In the beginning, she noted that she was starting to get like these, they felt like almost like paper cuts on her vulva and she didn't know what that was all about, but she kind of let it go, but it started to get worse. And then what she noticed is she started to get like this greenish, yellowish discharge that started to come out of the vagina and start to stain her underwear. And again, she wasn't sure what that was from and didn't know. So she tells me about her journey that, so she had been struggling with infertility for like 3 years, right? So 3 years prior. But then also once she developed like this discharge that she couldn't figure out what it was, she kept going to her provider, who is a midwife. And I love midwives. I think they're fantastic. And they do so much great work and they, are really great assets to have. But she went to her midwife and her midwife wasn't able to figure out what this was that was going on. So she had these cuts in her vulvar region. Then she started to have this, this yellow, greenish discharge that started to come out of the vagina. And then what she noted was that she started to have this pain with sex and bleeding every time she would have intercourse with her husband, she would bleed. And so she had like this crazy thing, right? She had this yellow green discharge, then she had blood, and then she stopped having sex. And she was like, I don't know what is going on. So then she was struggling for another 2 years. So remember her journey. So she had infertility for all this time, right? So she'd been suffering with that. And then she was taking a break from her infertility treatments. And now all of a sudden she developed like these cuts, this pain, this bleeding with intercourse, this yellow green discharge. And she had no idea what the heck is going on. She goes to see her provider. Provider doesn't know what it is. She keeps going back and forth. Her, provider is treating her with all of these like antibiotics, still no help. Then she goes, so her provider then doesn't know what to do. And so her provider sends her to a dermatologist. So now she's at the dermatologist and the dermatologist is like, he doesn't know what it is. He starts treating her with some steroids. It gets a little better, but it's not better. And then he starts injecting her with steroids in those cuts. Okay, can you imagine? So already she's like suffering. She has all this irritation and pain. And now her provider thinks that maybe it's something, he's not sure what it is. So he starts injecting her with some steroids and it's not getting better. And then after all of that, poor thing, she comes to see me. Okay. Now I will be honest. I am not like this world renowned, sex med doc. Hopefully I become one day, but I'm learning just as she's learning. And she comes to see me and in the back of my head, I'm thinking, oh, great. What is this? This is going to be something super complicated. But what's fantastic is that I have friends and I have these great friends that literally wrote the book. And so I asked one of my friends, acquaintances, Dr. Jill Craft. She's fantastic. She and Dr. Goldstein and Erwin Goldstein wrote a book called When Sex Hurts. They also wrote another book. There are some authors on this other book called Female Sexual Pain Disorders. And thankfully, I have both of those books. And so then I start reading, right? Like crazy. Like, I'm like, what the heck is this? I need to help this woman and I don't know what this is. But I figured it out. I figured out what it was. And I thought it was lichen planus. So all that long story to tell you what we're going to be talking about today is something called lichen planus. And I'm so glad that I have these friends that I can call and that have literally written the book to help me with diagnosis and with treatment. And remember, like, these physicians obviously are not, like, Dr. Jill Craft is the person that I was asking, and she's located in Tampa, Florida. And actually, she was on one of my podcasts. So if you want to take a listen to the podcast that I had with her, go take a listen. And we talk about these vulvovaginal disorders. But anyway, so I thought that it might be, reading up about this disease, and I'm going to get into what all it is, right? So kind of like how it presents, what the symptoms are, what the diagnosis, how you get the diagnosis and all of this stuff. But thankfully she was there so that I could, all I had to do was just text her and ask her, and she helped me out. So that was fantastic. And then I'll tell you how the patient did. So here we have lichen planus. So lichen planus, just like lichen sclerosus, is another autoimmune mediated dermatitis that can involve the skin, the mouth, the scalp, the nails, the genital mucosa. So what's interesting about this is that lichen sclerosus doesn't go inside the vagina. Okay. Whereas this lichen planus will can affect like the mucous membranes. So it, can in fact affect like the inside of the mouth. People can get like these oral ulcers, but also they can get ulcers inside the vagina. So that's kind of like the key distinction, right? And also, from what I saw in this patient, her lesions on the vulva were not like these pale white lesions that I noted with lichen sclerosus, those paper thin ones. For this patient, for the one that I'm thinking of, what she had were literally cuts on the outside of her vulva, and on the inside, she had this discharge. I mean, she couldn't even tolerate a vaginal exam. It was so painful for her, and I could see the ulcers inside the vagina, and I could see that yellow-green discharge that was also inside the vagina. So she had all this superimposed. So she had basically these cuts, and then these cuts had gotten infected. And so that's what that yellow green discharge was. And they call it erosive lichen planus. And I'm going to tell you a little bit about that. So lichen planus, right, can affect like all of these mucous membranes. It can have, you can have vulvar or vaginal disease, and it can be erosive and scarring. And so when it is erosive, what does that mean? It means that basically it causes like ulcers, right, inside the vagina. So that's really the main distinction, is that lichen planus will go inside the vagina, whereas lichen sclerosus will not. And so this erosive lichen planus goes inside the vagina, like I mentioned, and it can affect the vulva and the vagina, whereas lichen sclerosus typically just affects the vulva, right? Lichen planus can also cause scarring on both of the surfaces. So it can cause scarring on the outside, which is what I saw in my patient. And I also saw the scarring on the inside of the vagina. And that's why, so she had developed all these ulcers, and that skin was starting to get stuck to itself on the inside of the vagina. And so, every time she would try to have like this penetrative sex, she would notice like the bleeding from the ulcers that were inside the vagina, but also it was shortening the vagina. So she was having pain with intercourse. So it was causing a lot of problems. So the lichen planus can cause scarring on both surfaces, and it affects the keratinized and the non-keratinized skin, and can cause pain with penetrative sex. And that's kind of what I was telling you about her pain that she would have anytime she tried to have sex with her husband, right? And then I think she just stopped. She's like, this is horrible. This is painful. Her husband was all upset. He didn't want to hurt her, and he felt like every time they had sex, she bled. So he was like, forget it. We're not having sex anymore. And she felt the same. So it was, their relationship was really tense, and it was really rough for the both of them, because she was one of those individuals that loved her spouse very much, and he loved her, and they enjoyed each other and enjoyed having sex. And, that was a big part of their relationship. And so when they couldn't do that anymore, it caused a huge strain in their relationship. Some of the symptoms that patients can present with are, burning, pain, itching, especially, with urine or intimacy. You can have bright red erosions, which is what this patient had. When I did the speculum exam, I saw all of these, like these red ulcers inside. And they can be with white lacy borders. There can be vaginal discharge. There can be a lot of bleeding after sex. There can be like this pain with the vulva and the vagina. And, there can be vaginal discharge that I mentioned, but also kind of destruction of that vulva-vaginal anatomy. So basically it can like distort it, right? Because if it's causing all of this like erosions and ulcers inside of the vagina, that tissue is going to, start to stick to itself. And then it's going to cause kind of shortening of that vagina, but also it's going to be painful, and it's going to start to change the architecture. And in her case, I'll tell you that on the outside of the vulva, I noticed the scarring, and it was starting to change the architecture of her labia minora. So really, like, everything was being affected. And over time, they can have narrowing of the vaginal opening. There can be pain with sex, and even vaginal stenosis. So remember what I mentioned about how that there was shortening of the vagina. So that's what vaginal stenosis is. So when it like starts to shorten, and that can be very painful, right? And this is what this patient was starting to experience. It can also be associated with resorption. So remember when I said that the anatomy was starting to change on the outside? So yes. Also, you can have what's called resorption of the labia minora. So basically, when that labia minora starts to disappear, that's what resorption means. It starts to disappear and to go away, and you can have narrowing of the opening of the vagina, and even sometimes obliteration of that vagina. So remember, if that tissue is kind of collapsing on itself, and it's starting to get stuck because of all of that scar tissue that's forming in the inside of that vagina due to all of those ulcers, then it's going to shorten that vagina. And, if it persists, right, and if the patient is not able to get help, and if nobody's able to figure out what's going on, then who knows, you can have some significant changes to that vagina. So again, people think that lichen planus is this autoimmune disease. It's primarily T cell mediated, and it's driven by this cytotoxic CD8 plus T cells, that basically these mucosal variants can affect the vulva. It can affect, oral inside the mouth, and they tend to be erosive, right? Causing all those ulcers and scarring like we talked about. It's really important to know that this lichen planus affects about 70% of patients and carries a small but real risk for malignant transformation, about 1% to 2%, making surveillance really important. So every 6 to 12 months. Standard treatment for this is steroids. So again, for both lichen sclerosis and lichen planus, we use steroids to help control this, because again, if it's an autoimmune response, you want to suppress that immune response by high dose steroids. And so there's a medication called tacrolimus that we use on the outside of the vulva for the scarring that happens on the vulva due to this lichen planus. And also what we can do for the inside. So let's talk a little bit about what we do. So you have this patient whose inside and outside is being affected. So the outside, we use these high dose steroids. The inside, we use a compounded medication to get rid of the scarring. So we use estrogen. We use estrogen. We use an antibiotic if we think that there is some bacterial overgrowth due to all of these cuts, and especially if they have a yellow and green discharge, that can mean that they have something called desquamative inflammatory vaginitis, which is basically an inflammation that happens due to this lichen planus, this erosive, right? So this lichen planus that is causing all of these ulcers to form inside the vagina can also have a bacteria superimposed on it. And then it can have, and that's what is the cause of that yellow-green discharge, right? So that yellow-green discharge happens because of like this superimposed bacterial infection that can happen due to all these ulcers that are inside of that vagina. And so for that, we use, so we'll use the steroids on the outside, and on the inside, we'll use steroids, we'll use an antibiotic. So it comes in a compound. You have to actually go to a compounding pharmacy and have them make it for this patient. So in that will be estrogen to help kind of with that tissue, right? You want to encourage normal tissue inside the vagina. So you need estrogen for that. You need, if you have this yellow-green discharge, there could be some infection. So you need like a antibiotic for that, along with a steroid. So oftentimes what I did for this patient, and I'll tell you, I'll finish up the story at the end of this, but I'll tell you what happened with this patient and how I treated her. But in this case, when there are, oral and vulvovaginal skin that is involved, you want to use kind of like a multi-pronged approach so that you treat everything and not so much. So, I, with this patient, the one that I had, she did not complain of any type of, oral lesions, like things in her mouth. She didn't complain of that. Her main issue was all, focused on the vulva and the vagina. And that's where all of her issues were. So I did not treat anything orally on her. So how's this diagnosis made? So, diagnosis again, this poor thing, my patient had had multiple biopsies done. So of course I did not do any more biopsies on her. She didn't need any more biopsies. She had so many done. She brought me all the results. And what they noted on those biopsies were some parabasal cells, which can be a sign of this lichen planus and also of the desquamative inflammatory vaginitis, right? You can see actually those parabasal cells with them. But anyway, so with her, the diagnosis was, you do the biopsy, and you're doing the biopsy because you're trying to make the distinction between lichen sclerosis and pemphigoid or early high-grade neoplasia, right? Early high-grade like cancer. You want to make sure she doesn't have any of those things. And that's why you always want to do a biopsy. So anytime, we do a biopsy to come with come up with a diagnosis, but also to make sure that there's no cancer with that, right? So that's also one of those super important things. And of course, like I talked about, so like the treatment for this lady, what I did for her. So once we figured out what she had, right? So I thought, because I saw that she had this discharge that had been going on for so long, and it was yellow green, and she had pain with sex, and also she had bleeding with sex. I thought, okay, she has this. To me, all of a sudden in my mind, I thought, okay, she has this desquamative inflammatory vaginitis, which actually is going to be the next episode in this podcast series of like vulvar conditions that I'm talking about. But because she had this basically erosive, right, these ulcers that were happening due to this condition of lichen planus, I knew that she had this, and she had this, yellow-green discharge. I knew there was some infection there. So I treated her with a steroid on the outside and then a compounded medication for the inside. And I asked her to use a dilator. So actually, I had some dilators in the office, and I gave her my set of dilators, and I asked her to put the compounded medication on those dilators so that it would prevent that scarring from happening. So for this erosive lichen planus, you can use topical clobetasol daily initially, and then you can transition to maintenance. For her, actually, though, I used topical tacrolimus. Tacrolimus is another type of cream, but it is a steroid-sparing alternative. So it's not a steroid, but it is a cream, an ointment that they can use with a similar efficacy, and it actually worked fantastic on her. She put that on the outside, on the vulva. She put that on the outside of the labia minora. And then for the inside, when I talked to Dr. Jill Kraft about this tacrolimus, right, for this patient that had the lichen planus, Dr. Kraft recommended that the patient actually put the tacrolimus in the fridge. She said that sometimes this medication can burn a little bit for patients that have this lichen planus. And so you want to put it in the fridge and apply it cold at first. And she said because it can burn for the first few days, especially because they have all those cuts, right, on the outside of the vulva. And so she said always put it on cold because that'll help. And if it's not too severe, you can treat with vaginal estradiol and hydrocortisone cream. So she was talking about like for the inside. So now, we dealt with the outside. We're going to give her topical tacrolimus, but for the inside of the vagina, where she had all these lesions on the inside, right? And it was, you had, the bleeding coming from the ulcers that were forming on the inside. She said to give a combination of this estradiol, estrogen, vaginal cream along with the hydrocortisone. So again, you're going to have to get it compounded from the pharmacy and have a compound that combines the two of them. And she said that she has them put it inside with the dilator to prevent that scarring, right, that we were talked about. And some of that steroid filters to the vestibule. With the vestibule now, we didn't really mention the vestibule, but the vestibule is the part of the vulvar anatomy that is leads to the entrance of the vagina. So it's right like on the outside. And she said that some of that cream will filter to the vestibule and that will help, right? Sometimes though, if patients have a lot of pain, you can give them an estrogen testosterone cream for that vestibule, so to decrease the pain. But also, so now that you're coating this dilator, you're putting the estrogen on to help fix up that tissue on the inside of the vagina, and you're also giving like the steroid to cut down the inflammation that was on the inside. But if you notice that they have like the yellow green discharge that I talked about, that can mean like there's maybe a bacterial infection inside as well, right? Because of the discharge that the patient was having, then what you want to do is you want to add clindamycin to that compound. So that compound is a compounded suppository that basically is going to contain estrogen. It's going to contain three things. Okay, it's going to contain estrogen, it's going to contain hydrocortisone, and it is going to contain clindamycin. And that clindamycin is going to help get rid of any type of bacterial overgrowth that resulted from all these ulcers that were inside that vagina. Okay, and after that, that patient should do much better. So my patient, let me give you a recap as to what happened to her. So once we figured out what she had, right? So her diagnosis was really erosive lichen planus with desquamative inflammatory vaginitis. Okay, so she had this whole big thing. And so what I did is I treated her with that compound, that estrogen, that hydrocortisone, and that antibiotic, along with that tacrolimus on the outside. And I will tell you, she did amazing. She was treated with that for, I'm trying to remember, I think I did it for like 2 weeks, where she did that vaginal suppository, or I may have done it for a little bit longer. I can't remember exactly how long I did it for. But anyways, those vaginal suppositories, we did that. And then we also had her do the outside tacrolimus. Okay. She came back in a month. And oh my goodness, did she, like, her vulva was like night and day from the first time I saw it, right? So those ulcers were gone, that bleeding was gone, and like the pain on the outside, everything was gone. It was healed. It was amazing. Literally, it was like magic. She was so happy, and she was crying in the office because she couldn't believe that it didn't hurt, that her vulva didn't hurt anymore, and that she wasn't bleeding all the time. And then remember, anytime you have pain, right, in the vulva, and if it's like going on for so long, and remember, she was trying to have intercourse with her partner before, and she would always bleed and all this stuff. She developed secondary vaginismus, same thing, right? She had that fear of penetration. And so those muscles around the vagina tightened up in anticipation of any type of penetration. So because of that fear, she had this vaginismus. So, I talked to her about going to a pelvic floor therapist. She started seeing one. And then I saw her 3 months later, and she was like a new person. She told me that everything was fantastic. She was starting to have sex with her husband again. She was seeing the pelvic floor therapist, and it wasn't painful. Penetrative intercourse wasn't painful. And she stopped bleeding. She stopped bleeding after intercourse, because before, for the last 2 years, she would bleed every time she started to try to have penetrative intercourse. And she had all these cuts and all this stuff. And it was just such a mess that she was so, so grateful that now she was healed. And, I'm hoping to get her on one of my podcast episodes so you can hear her full story. She did fantastic. I mean, she did so good, and I'm so grateful. And so now we're keeping her on a maintenance, right? So she's not doing that clindamycin on the inside. She's just doing like the estrogen along with a little bit of steroid. And she's just going to do maintenance. She's going to do like once a week on the inside for like the rest of her life, and on the outside of the labia, and on the vulva also, for the rest of her life, because she's going to need to maintain it, right? Because we know it's an autoimmune disease, and we know that we have to kind of, because it is an autoimmune disease, it's going to need to be maintained by giving these steroids, right? So I can't just stop it. If I stop it, she's going to develop this whole scenario all over again, and she's going to be a mess. So I need to continue it so it doesn't happen again. And that was her story. And that was her story with lichen planus. And I'm so grateful that, again, I had these great physicians that I could talk to and get suggestions from regarding treatment, because it makes such a difference in a patient's life. And it really changed this woman's life. It changed her relationship with her husband. And, she's so much happier, and she's not suffering, which is really the goal, right? The goal is to help patients out and not have them suffer. So I was super happy with that. And that's it. So if you are suffering from lichen planus, and if you are suffering from any one of these like chronic conditions like lichen sclerosis, lichen planus, or if you have this chronic itch, this chronic burn, this pain, this bleeding after intercourse every single time, right? Make sure you go and get checked out. Make sure you go and see a provider that will know how to do the workup and can help you. And if you've gone to somebody that doesn't know, then find somebody who can help you. And so there's a website. There's an organization called the International Society for the Study of Women's Sexual Health. It's called ISWISH. And you go on that site and you look for an ISWISH fellow in your area. They have them by, different states. That doctor will be able to help you. So if your usual doctor, maybe it's your primary care, maybe it's your gynecologist, whoever is not able to help you with whatever it is that you're suffering from, make sure you go and check out that website and find a provider in your area that is an ISWISH fellow that can help you come up with a diagnosis if you are suffering. And well, we are done here. It's been real and really intimate. And I'm so glad you joined me for this episode. And I hope you learned something, as I learned when I had to deal with this patient, because this was the first patient I ever had with lichen planus. And, I learned so much, and I was so grateful that I had the resources. So, if you are suffering, you don't need to be suffering. So make sure you get the help that you need. And remember, this is not meant to be any type of medical advice. So if you have any questions about your health, anything at all, make sure you go see your healthcare provider. And remember, until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.